With all the focus on health during the pandemic, a Productivity Commission report has found that Victoria is one of the lowest spending states per capita on hospitals. The national average is about $3,000 per person. Victoria is spending just under $2,700 per person. Let's bring in the opposition spokesperson on health in Victoria, Georgie Crozier. Georgie, surely these numbers don't come as a surprise to you because you would have been looking at these figures intently for many, many years.
Well, Chris, these are really very poor numbers, and it just shows just the underinvestment over many years by the Labor government here. I mean, these are failing on all three metrics, whether it's funding, staff numbers or bed allocation. These metrics are really important, and it's no wonder our health system is in such a dire mess and in this crisis that just continues. This is underinvestment of years, over many, many years. Daniel Andrews has been Health Minister. He's been Premier for 11 of the past 15 years. So some responsibility has to be put shooted home to him.
Let me make a case on behalf of Daniel Andrews, which is not something I do very often. But Victoria, as a highly centralised state, a small state geographically with a high population, you would expect, wouldn't you, that the cost to be lower per capita, say, than other states where they have a population spread out across vast areas, so it's going to be a lot more expensive to deliver hospital care to all those people.
Well, sure, Chris, you can argue that, but don't forget those other metrics. This is funding per patient. This is also talking about bed allocation and staff numbers. So those are the other critical metrics that are really putting huge pressure on our health system. And as a result, we've got a health system that's in crisis. We're in code brown still. We don't have the same hospitalisation numbers as New South Wales has. We're well under 1,000. There are multiple thousands in hospital in New South Wales with COVID, yet we can't cope. And the elective surgery suspensions that keep on going are just having such an enormous impact on so many Victorians whose health is deteriorating and their quality of life as a result is suffering. And this is going to have ramifications into the years to come. So, you know, as I said, Daniel Andrews has been Health Minister and Premier. He's responsible for making these decisions, and this is years of underinvestment and could have and should have done much better than what's been done.
Now, while we're pleased that the vulnerable are vaccinated in this country, and in fact well over 90% of the population is vaccinated, that's a good thing and we encourage that. I want to get your views on vaccine mandates because some nurses, some teachers, some police are being kept from work because they refuse to get vaccinated. I showed at the top of the program how the latest research published in the Lancet Medical Journal shows that studies in the US, in Israel and in the UK shows that people catch and spread the virus just as much when they're vaccinated as when they're unvaccinated. So there's no reason, is there, to keep those vaccine mandates in place? Is it time for them to go?
Well, we've never supported broad spread mandates. We've all been very clear about this from day one in terms of protecting the vulnerable. Yes, I think there is an argument to have that healthcare workers need to be protecting themselves so that they can be protected as much as possible. But you're right in terms of spreading the disease and the information that's coming out. And I think we've learned a lot over the last 2 years. And of course, we've got a huge amount of our population now vaccinated, which is tremendous. But we've also got new treatments coming on board, the antivirals, which are really showing some promising results. And, you know, these blanket rules that are applied, especially here in Victoria, against so many workers who are cut out of society, has been having a really detrimental effect on so many people. So Daniel Andrews is talking about mandating others.
Thanks so much for joining us. Yep.
Okay, thanks, Chris.